Welcome back to TV5 News at 9, everyone. It is time now for Medical Moments with Covenant Healthcare. And joining us this morning, we have Ann Hoffman. Ann, it is good to see you. How are you?
I'm well, thank you.
Yes, of course. Thanks for coming in. So today, we're going to talk a little bit about your diet and your work with the Covenant Cancer Care Center. So you're a clinical dietitian. Just tell us a little bit about your role there and what you do.
As part of the multidisciplinary team, I help patients who are receiving chemotherapy or radiation, or those preparing for surgery or recovering from surgery. I help them eat well, hopefully, so that they can heal well, stay out of the hospital, prevent infection. So I work along with the pharmacist, the nurse, the doctor, and the social workers to hopefully help ensure the best experience for the patients.
What I really like hearing about the Cancer Care Center, it seems like you guys are really great working together for your patients.
Yes.
This is great. So we know controlling the things you can, taking care of your body with physical movement or good mental health, regular screenings, it's all a part of the checkup. But another key part of cancer prevention is what you eat. So just tell us a little bit about why that matters so much.
Well, for our patients healing and, of course, receiving treatment, certainly protein is important. So animal products, peanut butter, nuts, eggs, dairy foods.
Okay.
But long term, we usually try to recommend a lot of plant-based foods, so for cancer prevention.
Sounds like you need a balance in there. So what would you suggest a balanced diet might look like?
So usually trying to get all of the key nutrients, so including a couple, or actually 3 calcium servings a day, which could be from dairy, also could be from almond or soy milk or calcium fortified food, as well as protein sources like I mentioned, lean meat products or peanut butter, nuts, beans, and then a variety of fruits and vegetables, always emphasizing a good amount of those. And then of course some carbohydrates to help round it out to provide fuel.
Very good. And I know that there's this myth out there, eating less is healthy, but what would you like our audience to know about that?
Well, I usually try to help my patients, and really we all have to remember this, to try to eat when we're hungry and stop when we're full.
Yeah.
And, you know, there's some research looking at perhaps fasting for certain periods of time, perhaps 8 or 12 hours in a 24-hour period might be helpful for disease prevention, but the research is still somewhat limited in that area.
Okay, and for salts and fats, you know, these are words that maybe people will stray away from because they think it's bad, but our body actually may need it, right?
Sure. We do need a certain amount of good fats, if you will, and salt or sodium in the diet every day, but most of us eat more than we need. So again, it's a matter of trying to choose lower sodium or lower salt foods, and also trying to choose lower saturated fat foods, trying to stay away from a lot of rich desserts, a lot of fatty meats, and a lot of, you know, trying to reduce intake of fried foods.
Man, that's so hard sometimes.
It is.
Don't you think?
It is.
I mean, how can we make sure that we're not overindulging?
And I think, you know, what I really try to encourage is trying to enhance your diet with a lot of plant-based foods. So add that variety of fruits and vegetables, that array of different colors. And hopefully that will take up more space, and so there won't be as much room for that overindulgence.
Yes, okay, great tip. And any advice or tips that you would have for our audience out there that you would like to leave us with?
Usually I like to recommend, you know, easy on the saturated fats. So cutting back on red meat and unfortunately processed meats. I'm trying to really limit those. There's a lot of science around the fact that eating less of those helps prevent colon cancer and other cancers as well.
Okay.
And again, enhancing with more fruits and vegetables, more of those preventative foods to help with cancer fighting and cancer prevention. And then lastly, to enjoy water as a main beverage versus a lot of sugary drinks.
Yes, it helps me get through the mornings sometimes, these early mornings. It does wonders.
Sure, it does.
Anything else you would like to add?
Nope, if people are looking for additional information, the American Institute for Cancer Research, it's www.aicr .org is a great place to go for recipes and more information regarding research and cancer relation.
The recipes will be good. Ann, thank you for your time this morning.
You're welcome, thank you.
Of course. And if you want more information, make sure you just go to the hot links page for today's topic. That's on our website at WNEM.com.